Social Services Annual Board Update, Ms. Rogers.
Good afternoon.
Mr. Chairman, members of the board, Dr. Casey, good afternoon. My name is Jay Payne, and I currently serve as chair of the Chesterfield Colonial Heights Social Services Board. I am happy to come before you this afternoon, and on behalf of our board, we would like to thank you, the Board of Supervisors, for your support to Kiva and the Department of Social Services over the past year. As you know, our board provides administrative and policy oversight for a department that works with individuals, families, and our community to encourage self-sufficiency, preserve and restore families, and protect the well-being of children, senior citizens, and people with disabilities. And those of us on the Social Services Board believe this to be incredibly important work on behalf of our community. On our board, we have Mr. Engel representing the Board of Supervisors. We thank you for your service, sir. Also representing Chesterfield, we have Angie Grant, our first vice chair, Juan Santa Coloma, our second vice chair, Dr. Shauna Mayo, and Kathy Robbins. And from Colonial Heights, we have Mr. Chris Coleman, Betsy Luck, and Richard Yates. And if I could, I would like for them to have a chance to stand and be recognized.
Thank you all.
The board would also like to express appreciation to Dr. James Worsley, representing County Administration. Dr. Worsley, we thank you also for your guidance and support as well. Today, our board would like to brief you on the successes and challenges of the past year, as well as opportunities that lie ahead. We've asked Kiva Rogers, our director, to come and present this report to you. Kiva's been the Director of Social Services since 2016, and over the past 6 years has led this department with excellence. She is a leader with vision, a heart for her employees, and a deep commitment to providing services effectively and efficiently on behalf of our customers, and we are extremely fortunate to have her serve as our director. Working with Kiva are Assistant Directors Danica Briggs, Eugene Walton, and Karen Riley Jones, and they each have extensive experience and expertise, and along with Kiva form a social services leadership team that, in my opinion, is second to none in the state of Virginia. So I will close by saying that social services work is hard work. It's demanding, it's stressful, and oftentimes it's heartbreaking work. But as I said, it is important work being done on behalf of those in need in both Chesterfield and in Colonial Heights, and our board is privileged to be a small part of it. So thank you for your time, and I will invite Kiva to come up and make her presentation. Thank you.
Thank you, sir. Hello.
Hello.
How are you?
Good afternoon. So my butterflies had kind of gone away sitting out there, and then I saw I was presenting after Matt Harris. And so going last, you already feel like you're doing the prayer before dinner. So thank you all, Chair, members of the board, Dr. Casey. I look forward every year to presenting on behalf of the Social Services Board the accomplishments of our department and our path forward in the coming year. This presentation will highlight, oh, okay, great, thanks. This year's presentation will highlight our work in the context of 4 strategic areas of focus. In 2017, we identified 4 pillars that have served as building blocks for organizational change. Over the last 5 years, our strategic efforts in these 4 areas have led to tremendous accomplishments. One being the reduction of turnover from 25%, just under 25% in FY16 to 10.23%, well below the target that Dr. Casey had presented for us, and we achieved that by FY19. In each area, you'll hear innovative ways that we have embraced a transformative mindset, making a difference in the lives of our workforce, our customers, our service delivery model, and the community that we are honored to serve. Let me first begin by highlighting our people, truly the backbone of all that we do. During last year's presentation, I shared with you that we were embarking on revising and implementing a state survey for our staff. I must share with you that many of my colleagues in the social services world question why in the world would we be administering a satisfaction survey during the height of what was being called the Great Resignation. But we pushed forward because we knew from experience in overcoming the challenges that we had overcome in the past regarding turnover and the impact on the workforce, that this information will be vital for us as we move to slow turnover and to rebuild our rockstar workforce. We onboarded 62 new employees during FY '22. That represents about 26% of our workforce. Given the number of new employees and staff who were in different seats on our bus, we knew that having a better understanding of the areas such as job satisfaction, employee engagement, and leadership effectiveness, professional development, and the long-term and short-term threats of separation would be essential as we led the department into '23 and beyond. We administered the survey and had a 52% response rate. Our greatest strength was in the area of teamwork. Much of this was fostered during the pandemic when we all worked together to lean in to address the issues that the community was facing. The area of our greatest opportunity is job fulfillment, where we had the lowest score of a 3.38 on a 5-point scale. This area looked at staff's satisfaction and how they were able to reach their full potential. The survey has helped to guide intentional efforts to promote career development plans, strengthen supervision skills of our leadership team, and infuse deliberate ways to reinforce the connection between every position and how they impact our vision, our mission, and our organization's why, and their personal and individual why, which led them to the work that they had come to love prior to the pandemic when workloads at sometimes felt unachievable. What I've described are efforts that we have taken to address organizational change. But what we also knew from overcoming the turnover in the past was that it was a combination of addressing organizational things as well as looking at compensation. And I have to pause for a minute on behalf of our staff to truly thank the Board of Supervisors for the role that you played in the pay study for our staff. I chose one quote out of numerous notes and testimonies that I received from our staff, just expressing gratitude for what you did and addressing compensation. This quote is from one of our employees who's a single mom who's worked for 4 years, has a part-time job. And so as a result of the pay study, she recently, actually it was a few weeks ago, was able to stop her part-time job. And the impact that has had on her family is tremendous. And so letter after letter, note after note, email after email, talked about not only the impact on the staff, but the impact on the family and their quality of life when they come to work every day, Monday through Friday, giving 110% to the community as public servants. Our customer. This year, we finished out the third consecutive year where the volume of customers who access our services in person was significantly lower than pre-pandemic times. This year, we're about 64% lower in on-site contact than in FY19. While calls continue to be the #1 way that customers are accessing our services, the DSS Docs email, something we created during the pandemic to help customers to access our services more seamlessly, is on course to outpace phone calls. We received 72,000 emails in FY22, with customers providing us needed documentation to process their benefits or to verify the application information.
Did you say 72,000 documents?
72,000.
Okay, thank you. I just wanna make sure I heard.
Where we have seen the most significant increase is in customers who are reaching out to us through our crisis assistance. These requests for assistance are typically individuals seeking assistance for basic needs such as food, utilities, medication, and shelter. In FY22, we opened up over 255 more cases than we did in FY21. We also made significant changes to our service delivery so that we can respond to the increase in volume of calls that we received. Over almost 1,000 more calls we received last year than this year. With many of the safety net programs ending that were put in place during the pandemic, housing instability has emerged as the leading request for assistance. Rising evictions and increases in rent and low inventory have made it extremely challenging to find housing for a person once they become homeless. This is particularly the case for some of our most vulnerable populations, such as seniors and families with children or people with disabilities. To address this growing need under the leadership of Dr. Worsley, we are taking steps to develop a multifaceted approach to address the county's response to this issue. Initial efforts will assess issues by looking at how various county departments are being impacted, such as from the sheriff's office, looking at the role that what they're seeing from a servant eviction perspective, to community enhancement, who's responsible for providing the resources that the county gives to the community and other departments to address this issue, to looking at social services and mental health, who are more likely to be the ones who see things from an individual boots on the ground perspective. We're all coming together to look at and identify what this picture looks like from a county perspective, and then we'll create a plan that aligns with the Greater Richmond Continuum of Care model so that we're able to connect our citizens to the pipeline for homeless services, regardless of what door they enter into. Concurrently, we are also working on a regional team who's partnering to look at homelessness and how we can address this issue on a regional level. We're maximizing each jurisdiction's funding that was received through the American Rescue funding. And so we're in the early stages of that, looking at a consultant to help us to chart that path forward. Dr. Worsley continues to serve on the Homeward Board, and I am on the board of the Greater Richmond Continuum of Care. These opportunities allow us to have a good perspective of what the resources are and how we can align our response to the greater regional efforts and resources that are available. Our mission begins with the words "in collaboration." It is truly through collaboration with other county departments, community partners, and businesses that we are able to transform the lives of those we serve. One example of the power of collaboration can be seen in the impact of a pilot project to find stable housing for children and families served through Chesterfield County Public Schools. As I shared, housing has historically been one of the most difficult challenges to overcome once someone becomes homeless. These individuals often present with multiple barriers to obtaining housing, such as outstanding balances from prior evictions or utility bills to low credit or criminal histories, which makes it a significant undertaking to overcome the barriers to achieve stable housing. Well, that's exactly what Bringing Families Home, a program through Housing Families First, accomplished through a pilot program that we administered starting in last year. But they made, through funding made possible through community enhancement, who creatively and flexibly use COVID response money. Bringing Families Home partnered with social services, children served through the McKinney-Vento program, through Chesterfield County Public Schools, Communities in School, and the Housing Resource Line to end homelessness for our families. So far, we've referred 54 Chesterfield families to this program. 27 have been housed or are awaiting a move-in date. These numbers may not be huge given the significance of the issue, but I assure you, like the starfish story, it made a tremendous difference for these families that now 27 families, even more individuals, because these are folks who have kids, now have a safe and stable place to call home. They have worked extremely hard to overcome tremendous barriers with the support of local and regional collaboration. Although initial funding has ended, Housing Families First secured a small grant from the REB Foundation that allows them to continue this program with us on a limited basis. I'm not sure if they've made it here or not, but I would like to recognize Beth Van Turnbull and Kristen Riddick. I'm not sure if they're here. Stand up. Beth is the executive director, and Kristen is a community program director for Housing Families First. And they have been tremendous partners with us in addressing an issue that sometimes you feel, there's so many barriers for families to overcome. But for them to have made such a tremendous difference in the lives of these 27 families is huge. And so I thank them for their partnership and the impact they've had on our Chesterfield families.
Thank you for mentioning that, because that should be noted. Housing is a significant issue, especially in light of what we're seeing with the rent eviction issues in the region, Chesterfield, Richmond. And so you'll be applauded for that effort, and the work you're doing in that area is certainly significant. And we look forward to discussing even more opportunities in the coming days. So, but I just want to highlight that and thank you and applaud you and your team for that.
Thank you. Next, we'll move on to looking at our community. Department continues to identify strategies and strategic partnerships with employers and workforce partners and with workforce development, within the workforce development pipeline. We're seeking to implement innovative ways to help customers who are unemployed or unemployed to obtain employment that pays them a living wage and ideally provides health insurance benefits. We continue to network and engage with the workforce development community through various groups, such as the newly created Chesterfield Workforce Development Committee that you heard about a couple months ago. We're partners with that collaborative effort. Also in July, I was appointed to the Capital Region Workforce Development Board, which will further increase our network and connections to workforce partners. You may have picked up on a theme of how we've been able to change our processes, resources, and positioning to move from a transactional approach to a transformational approach over the last few years. Instead of focusing solely on administering the benefits and services that we are required to provide, we do that and we do it well. We are very proud in our accomplishments in that area, but we've expanded our vision and our reach to developing and spearheading local efforts to address the larger systemic issue that we see from those who are accessing our services. And we do this from both a local, state, and regional perspective. And so that's how we've been able to move from transaction, not solely focusing on the benefits, but looking at what are the key themes that we're seeing so that we can be change agents to the system and the community that we're serving. Workforce development, like housing, is one of those areas where we have collaborated both locally and on a state level and regionally to create best-in-class approaches for our citizens. I just want to highlight a few initiatives that we did this year alone related to workforce development. This has nothing to do with the number of cases and widgets that we have to count for the programs that we administer. These are all innovative, visionary approaches to, again, be transformative in the people who show up at our door seeking our assistance. The first is a data sharing agreement that we engaged in with Virginia Employment Commission. It is the first of its kind. We are working with the Virginia Employment Commission to even create the reporting that allows us to get it, because being leaders, sometimes those are the things that you have to overcome, but we're willing to do it because the end product allows us to be able to access services to essentially get ahead of the workforce pipeline for folks who are already receiving unemployment services. We're able to have a direct connection with them to help give a warm handoff to Virginia CareerWorks, to let them know about the resources that we have developed within our department and our network. We have created a position whose sole focus is on community engagement with employers so that we can work with folks to find employers who can work with our customers. We have probably communicated and networked, to Dr. Casey's delight, I'm sure, with economic development more this year than in my entire history with the department, which is 21 years. So we are meeting regularly through that Workforce Development Committee that you heard about with economic development, who's at the table giving us job leads. They're finding the employers and we're finding the people. And so it's been a great partnership and collaboration across divisions within the county. Another example is the SNAP ENT education and training program, where we have become a SNAP ENT program as of February 22nd. This allows us to get additional resources from Virginia Department of Social Services to help people receiving SNAP benefits, a program that doesn't traditionally have work requirements. But if we get them to engage with us to find employment, then we are able to help them with things such as work boots if they need that, if that's a barrier, or to get a training or something of that nature. And so we're excited about that program. The last program that I'll highlight is the Full Employment Program. We have identified 6 employers who have completed agreements. This program provides employers who work with us to place our VIEW participants, the Virginia Initiative for Employment and Work, in their job. We will be able to provide them a small stipend to help support their salary. So we're trying to create a win-win situation to, again, do matches and warm handoffs for our folks who we're working with to try to find employment.
That's a great program that you just mentioned. I really applaud that. Excuse me. That's a great program you just mentioned there with businesses and agreements. I applaud that, and I think that's a wonderful thing we can even expand and work toward helping citizens in the different areas of need, especially with work, because it can be challenging for some of our citizens, as we well know. So I applaud that effort and in ways we can enhance that. And even how we can enhance it through the Workforce Consortium Board that Dr. Worsley and I sit on, because there are resources there that can be used to assist workers getting back in there. Dislocated workers and other workers who, for example, are unemployed for a whole host of reasons. So I applaud that effort and that expansion thereof.
Thank you. We've shifted the focus of the Full Employment Program to really trying to target child care providers. We launched in June a child care campaign, and it was after doing some assessment and exploration with community enhancement, economic development, and our social services staff who administer a child care subsidy grant, that we got a better understanding of what were some of the barriers that the community, whether it's families or whether it's employer, what they were experiencing regarding childcare, because childcare has emerged nationally as a barrier to employment. And so what we did was we launched a childcare campaign that's targeted at informing people of the resources that are available, how you can find quality childcare. We're also looking at how can we support childcare providers who classes have been reduced because of workforce challenges that many people are experiencing. And so we're trying to get childcare providers who've been extremely responsive to become full employment providers and take one of our VIEW participants to be a childcare provider. And so that's where our targeted efforts are. We're also working with economic development. Economic development is doing a information session for child care providers to let them know about financial resources that are available for them to be able to sustain the efforts that they're making to continue to take care of our community's children while their parents are working. And so that's another area or innovative approach that we have implemented this year. Again, just trying to be strategic and address the barriers that we see people experiencing. So moving beyond just administering, although it's very important work, child care subsidy, but looking at the bigger, broader impact of child care on the community. And we see ourselves as being a piece of that puzzle and solution for the county.
Along that line, are we working regionally with Richmond, maybe Henrico, Colonial Heights, along that line as well? Because they seem to voice that as a major concern or a need when we have our regional dinners of the leaders of all the municipalities in the area, the chairs and vice chairs. That seems to rise to the level of an agenda item that we've discussed over the past several months.
We have not done that regionally. Initially, we've started with Chesterfield and Colonial Heights. But that is something that at the end of this pilot or campaign, looking at, seeing how, are there any tweaks that we need to do? That is definitely something we can look at further, because you're right, it is a broader issue.
Kiva, I know one of the things during the pandemic, when we first got all inundated with closures and the restaurants in particular, we focused on an item that was an interactive map, and I know we've talked about it a couple of times, but that was that Chesterfield Eats program where you could see on a map where all of the restaurants in the county that were open and what their hours were and so on. And I know we had talked, I don't know, you and I didn't talk, but I think maybe some of us on the board maybe talked about the time, and we could replicate that in a child care model. But there may be some issues with that, and I just didn't know if that had come across your desk, but it sure would be great if I may not know, I could move to an area and just not know that there's childcare right next door to me.
Yes.
Or down the road, as opposed to driving 5 miles away to obtain it. So it was just, but it struck me as a really useful product, perhaps, that we could look into.
Yes, we are not at that point yet. Dr. Casey has definitely talked with us about, being able to know the census for Chesterfield, where there are open availability for folks, which classrooms have availability, which ones maybe we need to target with some initiatives to increase capacity because we see the need. So we are not there yet. We will need to move to that place using some of the data from the state's database to tweak it to figure out how we can do that. So,
Please, Dr. Casey.
This topic also is near and dear to our heart, but it's collective because the businesses need people to know how they can get to work and not be distracted by a child care issue, and sometimes having the child care provider closer to where you work or as you traverse to your commute makes it easier than some other point that you have to drive in a triangle every day. So that's part of the database that they're working, but they're also working, to their credit, there are many people. You might have 3 households within a neighborhood in close proximity that all 3 are being single-parent child care providers, and they're trying to position that maybe if one of the 3 learns how to adapt and be a business, and again, through a limited amount of children, the regulatory environment is very easy to set up a business and have the other 2 or 3 pay that person. So all 4 people are actually in the business of making money. Some may be going to work, some may be the child care provider themselves, or just whatever could be sharing programs amongst them. So all of that is on the table, and all of them, this is very innovative, and we're trying to use the tech tools that are out there, and because, Kiva's clients, if you will, are a great database of addresses and needs, we're starting there.
all right. I'll move on to talking about the public health emergency planning. So in March of 2020, on March 20th, 2020, public health emergency was declared. And for us, the way I'll explain it best is it changed the way we administer benefits by making a lot of things easier to access, streamlining processes, reducing processes so that folks could get access to the needed benefits. When the public health emergency ends, there will be a significant impact on the department as we look to unwind. We're calling it the unwinding program at a state level. Most benefit programs will be impacted. We have approached this similar to how we approached Medicaid expansion and successfully implemented Medicaid expansion, where our enrollment exceeded the projections. And so we have mobilized a team that is looking at all of these different areas, how we're going to engage and educate the community on what's happening, what's changing, deal with the customer service increase that we'll experience through people just having questions. Again, pushing information out to the community to help them understand. Looking at things from a workload management perspective, we have, for the first time, I definitely know since the pandemic, we're at about 4 vacancies with our benefit program specialists. We have Mr. Ingo, he definitely knows that we have definitely run a lot higher than that. I'm very proud of our folks for onboarding and addressing some separations from FY22, but we're staffing up to make sure that we have the staff available to respond to the workload impact. Also looking at some of our vulnerable customers, so like folks who receive long-term care, Medicaid. If there's a disruption in their long-term care benefits, it is a domino effect where they lose day treatment programs. They lose people who are coming into their home, which could be the only resources that allow them to age in place in home. And so we're taking particular consideration with those cases to really micromanage them so that our customers do not experience interruption. We have staff who partner with mental health, who a lot of folks, Medicaid is attached to their waiver for services. And so we're working with our staff who work with mental health to support their clients to ensure, again, that nobody falls through the cracks as we unwind benefit programs. And we're also looking at training. One of the things that changed is you did not have to do interviews for SNAP. So we have staff who have never had to do an interview with a client. And so those are some of the things that we're working on and trying to proactively respond. And we're anticipating the same positive impact that we experienced with Medicaid expansion when that came. Just wanted to highlight some of what you'll see in the data about Medicaid, which is our largest program. It doesn't paint a good picture, because what this data shows you is that the number of recipients is increasing and our applications are decreasing. This is because since the pandemic and the public health emergency, we have not been able to close any Medicaid cases unless someone passes away, they requested their case be closed, or they move out of the area. And so right now, like many, all localities around the state, we have about 20,000 Medicaid renewals that are just sitting there that we cannot touch. Once the public health emergency ends, then we're going to have to address those Medicaid cases. And so our applications really are going down with Medicaid, but you will see the increase in recipients, and it's because we haven't been able to touch them in 2.5 years.
Ms. Rogers, that kind of goes along with something that Mr. Howell and I were looking at last week in audit and finance, and that is, because we pay attention to a lot of the different statistics in the local economy. One of the things is our poverty rate in Chesterfield continues to decline year over year, and so that would really track with some of what you're saying. It's something that not a lot of people realize, but all the work that's gone in to expanding the pie of opportunity for people over the last 5 to 6 years, 7 years is really paying off, and we can see that in some of these numbers. So I really appreciate this presentation.
Thank you. Similar to SNAP, I mentioned, what you'll see with SNAP is our applications are going up, but it's different from Medicaid, where our recipients are going down. The reason for that is, even with the public health emergency, we've still had to do renewals and interims with these folks. And so as their family situation changes, they report that to us, and we have to either close their case, adjust their benefits. And so we've been able to work with these participants on an ongoing basis. And so where you'll see that our numbers are going down almost to pre-pandemic levels in terms of recipients, although our applications continue to be high and go up. This is a program that has continued to have emergency allotments that have continued throughout the pandemic. So that kind of explains the data with the discrepancy that you may see in some of our data. Looking at our business, we continue, like I said, we continue to do well with many of our targets in terms of quality. TANF applications, we're at a 99% timeliness. The goal is 97. Child care application timeliness, that's the area that had a significant increase in applications and recipients, 99.7. I forgot to mention that our child care program cleared our backlog during the pandemic, and we had a little over 100 and some kids who were on the backlog. We have maintained no waiting list for childcare since we completely eliminated the child care waiting list. And so even with the increases, they're still doing it timely, they're doing it with quality, and we're able to immediately get kids access to child care subsidy if they're eligible. Two things I wanted to highlight as it relates to child welfare are, I want to get to that picture so bad, is that we've had a historic reduction in children aging out of foster care. I'll tell you the connection to everything that I've talked about today. If a child ages out of foster care, 20% of those kids will instantly become homeless. And so by us working so hard and our staff working so hard to achieve permanency, they're impacting those outcomes that we're having to work with and support folks through later on in the continuum. Also, 1 out of every 2 foster children who age out of the system will have some kind of, so you have a 50% chance of having some kind of employment by the age of 24. And so the work that we're doing in child welfare will impact the community and society much longer. And so that is a tremendous accomplishment, that we are consistently reducing the number of kids who are aging out of the system. Also, child reunification with parents outnumbered adoptions for the first time since FY17. And that's where we come with our story that I want to share with you. June is National Reunification Month, and during that month, with the help of Worth Days, a local nonprofit whose mission is to ensure every child in foster care knows that they are worthy on special days in their lives, we were able to celebrate the reunification of a little girl with her father. Little did we know, one of the gifts included a book titled Girl Dad, and the dad and his daughter closely resembled the cover of the book, which resulted in them reenacting the same pose in the photo shown on this picture. This last fiscal year reunited more children with their parents, which we have not done in the last 5 years. This is significant because we've heard about the tremendous barriers that families have been facing over the last 2.5 years as a result of the pandemic and just economic conditions. When children enter foster care, our staff work diligently to identify maternal and paternal relatives to foster a familial support system for the youth and family. That is a best practice effort of family finding for our staff. And this situation is an example of why we do that, why we look for whatever branch of the tree we can find to help create some connection for kids to their biological family. This father was identified through family finding. So he may not have been in his child's life, but we found him through family finding, and he actively engaged in services. He continues to have the support of his family as well as the foster parents, another best practice. Kids have the best chance of not entering foster care, of not experiencing abuse and neglect again, when we can create a village or a support system around them. And that's exactly what this dad and this little girl have, because the foster parents are there as well, even though the child is no longer there. The young lady thrived in the educational program she was attending at Clover Hill Church, and the church granted the family a scholarship to remain at the school for the upcoming year. Angie Grant, who is a board member, if Angie should be here. She's one of our board members, and her husband pastors Clover Hill Church. And so this is a great example of why we do what we do and the impact that we have and the support network that we've been able to create for this family. And our staff do that every day. And this is a story of many children who receive our services.
It's important to note, though, that the parents that we're reunifying the children with are going through services and programs themselves to better be able to take care of their kids so that we don't end up in the same situation we started in. I think that people need to know that it's not just, oh, we're giving them back to a parent that's failing. We're actually giving them back to a parent that is doing everything they can to be a good parent and to be able to succeed with their children.
Yes, it is a rigorous effort for that. That's why I'm so glad you brought that up, Mr. Engel. While folks who do this work and our board who listens to our stories, the not so happy ones and the happy ones, know that for any parent to get to this point, they have had to overcome tremendous obstacles, whatever led to the child coming into foster care and whatever experiences they may have had as children themselves. And so our staff do that. They connect them with community resources, whether it's mental health, who works with both our kids and the parents. Churches, you just heard me talk about Clover Hill. You know, it is a robust treatment plan that before a judge will sign off on reunifying, this parent has had to demonstrate stability. Typically, it's about 6 months that a family has had to demonstrate stability with us still being there with a watchful eye and checking on, making sure that our kiddo is safe. So yes, it is, to get to this point, it is a huge accomplishment. This is what transformation looks like when our people are invested in our customers, incorporating best practices into our business in collaboration with our community partners who transform lives for generations to come. And so this is what, stories like this are what keep us motivated, keep us committed to leaning into doing the work of social services and beyond. And so as we look forward to FY23, I will close by just identifying some of the things that we're focusing on. Again, the public health emergency, workforce development. We're actually partners with the Virginia Department of Social Services to impact system change at a state level, looking at how policy is administered, in particular the shared accountability agreement between locals and state. I'm serving on that committee to redefine what that looks like. Karen Riley-Jones, who's my assistant director, is leading efforts to look at how the state administers their audits and compliance measures with local departments. We are audited significantly, and so greater coordination and collaboration with the state will help us to be able to do that well without creating additional stress for our staff. And so we're leading the way with those initiatives at the state. We're also working with the Learning and Performance Center. We're embarking on this to reimagine how we are delivering adult services within our department. I haven't said a lot about that in this presentation, but you can rest assured that next year we will be talking about some very creative and innovative things that we're doing to address the needs of our senior population. For us, that's growing and have changed and evolved. And so I'll say to my colleagues in other departments who touch seniors, they can envision an appointment on their calendar soon to bring us all to the table to see what every department is doing as it relates to seniors so we can come up with a plan collaboratively together. We're also invested a lot in our agency leadership development. We have created many things to just support and develop our leadership team so that we can lead our staff to, I call us mountain movers, so that we can remove mountains that are impacting our staff from doing the great work that they continue to do. And I look forward to celebrating with you, we're calling it a graduation of our benefit program specialists. We created a career development plan cohort, again, to try to improve job fulfillment with our staff. And so we've got a group of folks who are going through it together, and we will celebrate a graduation with them. Before I close, if there are any social services staff who are present in the audience, can you please stand?
Stand and be applauded.
I stand before you on their behalf and the board's behalf. And again, just thank you this year and every year for your support, your dedication, and the high bar that you set for us to achieve for the citizens of Chesterfield County. We are truly grateful. Thank you.
Questions from board members? Mr. Holland.
Yeah, I just want to compliment you on the outstanding job you've done, and certainly I see even our mental health directors in the audience, Ms. Freed as well, whom I'm acknowledging,
Yes.
for the outstanding work you've done over the last several years. It's been quite transformational, and because you touch people with their needs. And one area that I think if you can, we can look at and what can we do, certainly I welcome your input on housing insecurity, specifically with those who may be losing temporary housing in the county, and how we can assist those and meet those needs and make the connections so that when they do come knocking on your door, we have a plan idea in terms of housing availability in the county and other areas of opportunities that we can provide. So I just want to take this opportunity to thank you and applaud you for your outstanding work, and your team as well, who are here with you. I thank you, because sometimes we often challenge. We did challenge you years ago, and I thank Dr. Worsley as well for challenging you. But sometimes we fail to say thank you enough, and so we want to take this opportunity today to say thank you, and we applaud you, and your work really matters because it impacts people's lives and families here in Chesterfield County. So thank you all.
Mr. Engel.
I just want to thank you again for your leadership, for the department, and I know I've said it in the past, but I'm just so proud of how the department here works to change people's lives. When people hear social services, sometimes they think people that are permanently going to need aid, and our department doesn't look at it as people that permanently need aid. It's people that need aid so they can permanently take care of themselves. And that's the way the department's run. And that means a lot to me, and it helps me to get to the board meetings and to participate with the Social Services Board, which was not something I was excited to join when I was first asked. But I am very glad that I'm a part of.
We definitely appreciate you, Mr. Engel. Mr. Engel, he's like a barrier slayer as well. If I mention something in a board meeting, he's like, so what was that? Can I fix that? And so we appreciate you walking alongside us begrudgingly.
I just wanted to say I think your department's efforts in contacting those receiving benefits from the VEC, that work, that's going to be standard in the years to come. You watch every social services department in the state adopt that effort. You know, we talk about social services as a name, and there's so many components to that. But just what you said there, social preservation. But you all are building social capital, and that's what you've really engaged with here with this 360-degree look at people's lives. And we just can't thank you enough because you're making an impact. It shows in the numbers, and it shows in pictures like the one you show. So. Congratulations to each of you, and thank you for your work.
Thank you.
Thank you.
Thank you.